the 199th episode of Gyan Ganga, a Knowledge Voyage weekly webinar series. I, Dr. Jitika Duggal, on behalf of RV, welcome you all for today's session. On the outset, we would also like to express our heartfelt gratitude and welcome our mentors who have always been there to guide, motivate, and encourage us for sustenance of this series. Respected Padma Bhushan Vaidya Shri Devendra Trigunaji, President of Governing Body RAV, respected Vaidya Shri Rajesh Kotecha Sir, Secretary Ministry of Ayush, respected Dr. Vandana Siroha Ma'am, Director RAV. Let us begin the session by seeking the blessings of Lord Dhanvantari. I would like to introduce today's expert, Dr. Matthew Joseph Sir, who is going to throw light on plantar fasciitis, Ayurvedic perspective and insights. Sir has done BMS from VBS Ayurveda College, Kottakkal, Kerala, 1987. Sir has pursued his MD in Shannet Vikramaswa, Government Ayurveda College, Trivandrum, Kerala, 1991. Sir has several professional experiences since 1991, active clinical practice over more than 2 decades. Sir has area of specialization in practice as Asthi Marma Chikitsa, super specialization in sports medicine. As faculty experience, Sir has been guest lecturer in various programs. Sir also has various publications in his name, like repeated strain injuries and its Ayurvedic management, sports injury Ayurvedic concept, and Agni Karma. Sir has also attended several national and international seminars. Along with that, Sir has been awarded with several awards such as Memorial Bishop Pratibha Award, Bishop Pratibha Award, Drona Award, Special Honor of Professional Excellence. With that, sir, we are blessed with your esteemed presence here. I would like to invite you for beginning of our webinar session. Thank you. We shall begin the session now, sir.
Start. Shall I start?
Yes, you can share the PPT, sir. Yes.
Yes. I'm audible, madam?
Yes, sir. I hope the sir screen and audio is visible and audible to all. Kindly confirm.
How is my audio?
It's audible, sir. Completely fine, sir.
Yeah, okay.
Okay.
So shall I start? Right.
Yes,
Okay.
sir. Please start with the session.
Yeah, okay. Respected Padma Bhushan Vaidya Devendra Trigunaji, respected Dr. Rajesh Kotecha ji, and the director, Dr. Vandana Siroha madam, and all the respected gurus of RAV and my loving students. So, first of all, my topic of today's discussion is plantar fasciitis, an Ayurvedic perspective and insights. So, even though if you feel that it is a small, very small topic, it is having a high relevance in the clinical practice nowadays. As an Asthi Marma practitioner, and not only an orthopedic practitioner, every Ayurvedic practitioner may be having a lot of cases having foot pain as a presenting complaint. And I hope the basic, the 50-60% of the foot pain emerges as a result of the plantar fasciitis, which is the basic cause for heel pain. So let us have a discussion. So I am giving an overview of what is the plantar fasciitis and its pathophysiological conditions and its clinical diagnosis, its differential diagnosis, its prognosis, and its Ayurvedic interpretation, its Ayurvedic management through medicines, etc., and rehabilitation of related conditions, and the Marma consideration in this particular topic. So, first of all, definition, plantar fasciitis is a common condition characterized by inflammation of the plantar fascia, a thick band of connective tissue that runs along the sole of the foot, causing heel pain, especially during the first steps in the morning. So that may be the presenting complaint. Most people come to your OPD and saying that I have a foot pain in the initial steps, that too in the morning, or after a period of rest, I'm having a pain. And when I start walking for a 5 minutes, 10 minutes, it is getting reduced and finally it will be going away. So that will be the usual symptom the patient complains in our OPDs. The prevalence and common causes: overuse injuries, obesity, prolonged standing, improper footwear, and high impact activities like running. So that's why this condition is mostly seen in those who are having repeated long-standing jobs, and those who are prone to sports injuries are also victims of plantar fasciitis. So you just see the plantar fascia. So how it is being connected to the foot and the heel. See, you can see the long band of plantar fascia right from the starting from the heel, which is progressing to the anterior aspect of the foot. It is widely distributed to the anterior aspect also. The lateral band, the medial band, and also then you can see the Baxter's nerve, which is passing to the posterior aspect of the inferior to the calcaneal bone. So that is a diagram which shows the extent of plantar fascia in the foot. Right. The plantar fascia is a thick fibrous tissue that extends from the heel bone, that is calcaneum, to the toes, providing structural support to the arch of the foot. So that is the structure which gives you strength to the foot. A role in weight bearing and movement. It plays a crucial role in absorbing shock, distributing weight, maintaining a foot stability during standing, walking, and running. So in all conditions of locomotion, the plantar fascia is having a very good role to maintain, to distribute the body weight, maintaining the foot stability during standing, walking, as well as running. So plantar fascia is a very flexible structure, even though it gives you strength to the foot for giving a very smooth locomotion. So etiology of plantar fasciitis, you can broadly divide it into the traumatic conditions, the degenerative situations, and the mechanical stress. Repeated mechanical stress on plantar fascia, that can be one of the cause for plantar fasciitis, such as excessive strain from prolonged standing, running, or wearing improper footwear. That can create pressure on a particular area. Not an evenly distributed pressure may create some irritation, which causes mechanical stress to that particular area. Weight bearing area, as it is a weight bearing area, it can go for overuse injuries. Can lead to micro tears and inflammation resulting in plantar fascia. So you can just see most of the patients, they come with an X-ray saying that there is an inferior osteophyte in the calcaneum. So it is a usual presentation. Usually plantar fasciitis, usually 80-90% will be associated with a minor or major osteophyte in the inferior aspect of the calcaneum. So it doesn't mean that in all the cases of the plantar fasciitis, it is not present. So some selected case, some cases, it can be a very minimal osteophyte. In some cases, there may not be an osteophyte. Still, the fasciitis can occur. So the presence of an osteophyte does not always correlate with the fasciitis. So it is an added factor that such an osteophyte is having a good chance for creating overuse injury or to the plantar fascia. Okay. Plantar fasciitis, usually the patient has a heel pain. So there are a lot of conditions presenting in our OPD with the heel pain. So the differential diagnosis is a must. So you have to differentiate what all other pathologies can create heel pain. So shall we go to that area? So this will be the usual presentation in an OPD with a plantar fascial or a heel pain. The female patient come to OP aged mostly 45 with the heel pain. She has morning stiffness and pain on walking after a prolonged rest. So these are the differential points you have to see when a patient is having such a symptom. It can be as a result of systemic arthritis, a seropositive, seronegative spondyloarthritis. Such a lot of reactive arthritis may be as a part of systemic arthritis. So the second one is plantar fasciitis itself, simply as a result of the inflammation of the underneath plantar fascia of the heel. Third one is retrocalcaneal bursitis, which is also presenting with the heel pain. Fourth condition is Achilles tendinitis. So you know that the Achilles tendon is the plays a key role in the locomotion of human being. So it has got a tremendous loading while running, walking, standing, or all of this. So this the Achilles tendon is being attached to the tendocalcaneum through to the posterior aspect of the calcaneal bone. So if the Achilles tendon is being irritated, totally irritated, totally what you call overused, it can also go for an Achilles tendinitis, which is also a cause for the heel pain. And another one is S1 nerve lesion. As a result of spinal pathologies like disc diseases, spondyloarthrosis, and multiple causes of the spine, as a result of if the S1 nerve root is being affected, radiculopathy, S1 radiculopathies, so there can be a heel pain. And the sixth one is haglot deformity. You know that some having a genetical predisposition for having a haglot deformity, which is a deformity to the calcaneal bone. I will show you in the next slide. So that deformity, those who are having that deformity, having a good chance of heel pain. Next one is posterior tibial tendinitis. So that is the seventh point, which is a cause for heel pain, posterior tibial tendinitis. And the eighth cause is calcaneal stress fracture. So there can be fractures of the calcaneal bone. So the major fractures, they will be symptomatic immediately and they will be getting treated initially itself. But there is due to repeated stress or a minimal fall, there can be stress fractures without displacement. Such conditions the patient may neglect for the time being and come to the clinic as that he is having a heel pain. So when you are exposing to an X-ray only, you will get the calcaneal stress fracture. And in some minute, minimal fractures, some CT or advanced imaging technologies may be necessary to rule out stress fracture. The ninth factor is heel pad syndrome. Heel is being protected by a layer of fat. So that fat pad syndrome is a cause for heel pain. If it is overused or inflamed, that can also be a cause for heel pain. And the 10th one is tarsal tunnel syndrome. That is an entrapment neuropathic condition, which is as a result of tarsal tunnel being compressed at the outcoming of the tunnel. So, incorporating protocols designed for pathological situations and if necessary opting anistastra, it can go for a comprehensive personalized approach to the patient care. So these are the basic 10 factors which is responsible for the heel pain. So when a patient is coming with a heel pain, you have to have a differential diagnostic consideration of all these things. So you should not miss any point other than simple plantar fasciitis. So this is an X-ray showing what is Haglot's deformity. So here you can see a prolonged a weakening of the bone to the superior side of the calcaneum. So that is a genetical or acquired deformity of the bone, which is creating a pressure on the calcaneal tendon and posterior tendon of tibial tendinitis. So these are all these structural change can create heel pain. Next one. So clinical features. So when you go through the clinical features, symptoms will be there, varied presentations according to the situation, the differential points and the level of the pathology, the symptoms will be different from patient to patient and to the constitutional level and this condition of the ama, everything, the symptoms will be different from patient to patient. Varied presentations will be there. So when you go to the examination, you will get a clear-cut idea what will be the underlying pathology for an understanding of differential diagnostic points in the management of heel pain. So the importance of diagnosis is very, very important. So you have to have a very good uh, understanding of what are the factors, differential diagnostic points which causes the heel pain. And the simple plantar fasciitis should be excluded from all other conditions which creates heel pain. The patient may be presenting with the heel pain only. So these are the on examination common causes for heel pain. If you can just see, number one, the plantar fasciitis, the patient will be having a tenderness in the anterior medial aspect of the calcaneum. That is the attachment point of the plantar fascia. So a plantar fasciitis, simply plantar fasciitis pain, patient may be having local tenderness at that area itself. The next level, you can see just the second one, backstage, the inferior calcaneal nerve is being pressed. That is called the backstage nerve compression area. So if it is being compressed, there can be a pain at that area. And the third one is you can see a fat pad is there. And if the fat pad is injured or if there is an inflammation of the fat pad, the pain will be and the posterior aspect itself broad, a wide level of pain will be there in the center of the heel itself, right? And the fourth point is you can see Achilles tendinitis. So that is an insertion point of the tendocalcaneum to the calcaneum. So that is a point where a tendinitis patient is having symptom. And Haglot's deformity patient, the point of tenderness or pathology will be, you can see here will be, that is the area where the calcaneum is being deformed. As a result of deformity, you will get a symptom there itself. And the sixth one is this stress fracture. In the calcaneum itself, you will get a tender point, and minute level stress fracture can create symptom at that area. So you have to get a imageology for understanding the exact what is the level of the stress fracture. Tarsal tunnel syndrome, the seventh condition. The anterior component of the tarsal nerve is getting pressed over by the fascia and creating an entrapment neuropathy, which is a site for the pain of tarsal tunnel syndrome. If you put a finger pressure at that area, there can be numbness radiating to the lower end of the foot, anterior part of the foot. And lumbosacral pain, which is a broad pain, which will be a sharp shooting pain, which is radiating below the knee along the particular dermatome, according to the nerve root being pressed, either an L5S1 or a L4 L5. Usually L5S1 root entrapment result in S1 radiculopathy, which results in a heel pain usually. So these are the 8 points where you have to see the differential diagnostic conditions for examining heel pain of a patient. So when you are considering an Ayurvedic perspective, correlation with Ayurvedic terminologies. So I feel that, so and the Nadathvadaja Vadavyadi as well as Vadavyadi, as well as our textbooks, Vada Kandaka is mentioned. So Vada predominant condition. So Vada Kandaka is can be, you can correlate with the pathological the formation of plantar fasciitis. And next one is an Uttana Vada Rakta consideration. Rakta Pitta involvement is there, and which is creating a fasciitis as a result of the stress or an what you call maybe an acute or an insidious inflammatory condition can go for Uttana Vada Rakta consideration also you have to think about. So Vada Kandaka, Uttana Vada Rakta consideration also should be a part of when you are correlating with Ayurvedic terminologies. And Samprapti, there can be a Kapha Varana as well as a Pitta Rakta Varana. So if the Kapha Varana is there, the treatment modality is different. If Pitta Rakta Varana is there, the modality should be, you have to be defined, the formal the modalities will be different from each other. When you are selecting the Anushastra Karmas, the Kapha Varana conditions and Pitta Rakta Varana conditions should be well understood before doing a Anushastra Karma. So, Ayurvedic perspective, you can think of a Vada Kandaka, Uttana Vada Rakta consideration. Uttanam, Lebana Abhinga Parishega Avagaha. Such treatment modalities are mentioned for Uttana Vada Rakta conditions. Vada Kandaka is being mentioned in the Vada Vyadi itself. So, Vada and Vada Rakta considerations are to be considered when you are dealing with the plantar fasciitis. So, Samprapti, Kapha Avarana will be there, Pitta Rakta Avarana or can be there. So, according to the situation, you have to select the internal medicines, external applications, and also Anushastra Prayogas. Treatment protocol. So, you have to think about these four aspects. So, a Marma Bhigada Chikilsa, Uttana Vadarakta Chikilsa, Bhagna Chikilsa, Snayu Sandhiyada Vada Chikilsa. All these 4 points you have to keep in mind when you are selecting the treatment, when you are selecting a protocol. So, which are the marmas which is relevant to heel pain, Purcha Siras, which are the marmas, and also Indravasti, a Mamsa Marma, Talakrit, which is Mamsa Marma, Gulfa Marma, which is of course a Sandhi Marma. So these are the Marma considerations when you have to take into consideration about the foot pain. So Purcha series, Talakrit, and Indravasti as well as the Sandhi Marma, Gulfa. So Gulfa is the condition where Gulfa Marma, when you take the Samanya Vitha Lakshana of Marma, Sandhi Marma Vitha Lakshana, Vastu Shugairiva Akirnam, Udecha Uni Kanjada, Vela Cheshta Kshayaka, Parva Shobascha Sandhiji. So Sandhi Marma Vitha Lakshana is well established in Gulfa Sandhi Marma Vitha Lakshana also. So we can take into consideration of Talakrit, Urcham, Urcha Sinas, Indravasti, as well as Gulfa Sandhi also. So these are the Marma considerations you have to think about when you are selecting the treatment protocol of a foot pain, especially plantar fasciitis. Uttana Vada Rakta. So the external modalities are very significant in the management of very relevant in microfractures, in small hairline, non-displaced fracture, Bhagna Chikitsa should be considered. Snayu Sandhigada Vadi Chikitsa also is a very important thing. Yes, Chikitsa Sutra, which is taken from Ashtanga Hridaya itself, Snayu Sandhi Gada Vada Chikitsa. That is Snayu Sandhi Sira Prapte Sneha Daha Upana. So Snehanam, Daha Karmam, Upana. So these are very important as far as Snayu Sandhi Gata Vada Chikitsa is considered. As Kurcha and Kurcha Siras are Snayu Gata Marma. So Snayu Sandhi Gata Vada Chikitsa is very relevant here as far as the plantar fasciitis and all foot pains are considered. So the management in Ayurvedic modalities, when you consider the internal medications, Amapachana Shovhara medicine should be selected. So when you, as far as the common clinics in Astimarma Bhigada Chilsa in Kerala, we used to take Amrutotharam Kashayam, Rasna Saptagam Kashayam, Rasna Panjagam Kashayam, along with the Shundi Churnam, Amavadari Kashayam. All these are very relevant in Amapachana, Sopahara, which is being indicated in the early phase of as internal medicines. And externally, labors are highly significant. Upanaha also is very essential, very useful, very having a very potential effect in the management of Uttana Vadarakta conditions, especially plantar fasciitis. Parishega Avagaha, which is very, very relevant. And the Panchakarma procedures in chronic conditions, Shodhana, and like that one. So, in my opinion, simple plantar fasciitis does not need any advanced Snehavana, Vasti, Shodhana, like that one. So, simple plantar fasciitis requires only external applications as well as Amapachana internal medications itself. So once the pain and inflammation is getting reduced, to prevent further recurrence, you can go through Anusastra, suitable Anusastra. So that is an applied aspect as far as my experience is concerned. So those who are having plantar fasciitis are as a result of generalized arthritic conditions like seronegative, seropositive arthritis, Reiter syndrome, or whatever thing. Such condition needs to be treated with the proper internal, after Amapachana, internal Sehanam and Shodhanam, and followed by Rasayana Chikitsa. So that is the situation when the plantar fasciitis is as a result of the generalized systemic diseases. You have to go for Amapachana, internal Sneha, Shodhana, Rasayana. So unless in normally simple plantar fasciitis, Uttana Vadarakta Chikitsa will be sufficient, followed by proper Anusastras according for prevention of further recurrences. So you can select even, so I can tell you more about the Anusastra protocol in the next slides. So Snayu Sandhi Sira Prapte Snehadahu Upanaham, it is very, very highly relevant when you consider the marma aspect of foot injuries as well as the pathologies of the calcaneal area. So this is very relevant protocol. Next one. Next. So apart from the simple internal medicines, Amapachana medicines like Rasna Saptagam, Rasna Panchagam, like that internal medicines, Yerata Thaila preparations are being found to be very effective in the management of Eranda Sugumara as an adjuvant to the various kashayas. Sugumara Eranda, potentiated Eranda, purified Eranda Thaila with the Sugumara Yoga, potentiated Eranda Thaila with the Nimbamrada Kashaya, which is very useful in the Vada predominant stage of the plantar fasciitis. And Sindhuvara Eranda is very, very relevant in the Kaphavrada stage of plantar fasciitis. And Hingutragana is very potential and having a very Srota Shodhana property, which is being used in an advanced acute phase of Kaphavrada plantar fasciatic conditions. So, Eranta Thaila is used as a single drug or along with the Kashaya in day-to-day practice nowadays. So the Anushastra protocol, Rektamoksha, Sringa Alabu, Siraveda, Jaluga. Agnikarma again divided into Snigdha Agnikarma as well as Ruksha Agnikarma. So these are the Anushastra protocol generally used in management of musculoskeletal pathologies and also injuries. So this is being the next one. This is being taken from relevant, recently published, a very good publication from my colleague Dr. Jiku Elias Benny, who has published a very good book in clinical orthopedics, evolved cases, insights in Ayurveda. So he has given a chart. So I am just taken that part for sharing you. So the clinical condition, deep-seated, more Pitta predominant condition, you can select a Jaloka. A single point, more Kapha predominant condition, Alabu or modified Sringa can be used. A whole body or single affected limb, which is very not relevant as far as plantar fasciitis is concerned. In such a condition, you can go for Siraveda. Soft tissue pathology with more Kapha, Rukshakti Karma. Soft tissue pathology with more Vata predominant conditions, Nigdagni Karma. Soft tissue pathology with more Pitta, Jaluga is being indicated. So this is a very good protocol for the selecting the Anushastra in the management of most of the musculoskeletal conditions and even sports injuries. So this chart is found very useful, and you can go through the book. It is a very good, very beautifully explained textbook and giving very good insights in the clinical orthopedics with Ayurvedic management and Anushastra and rehabilitation techniques. So regarding the next one, Agnikarma application of plantar fasciitis, Snigdha Karma. This is a very simple method of applying Snigdha Agnikarma. A coconut outer shell is heated directly over the flame or ember. After applying a prescribed oil over the painful area, foot is applied on the heated coconut shell. So there will be pressure, there will be heat, and Snigdha, as a result of the oil application, there will be Snigdha, and inbuilt inherent oily, the coconut shell is having a very good volatile oil inside. So it is a combination of heat, pressure, and also the Snigdha property of the oil, which culminates in the Snigdha Agnikarma. So Snigdha Agnikarma is a simple tool to give Snigdha Agnikarma to the heel conditions, especially plantar fasciitis. So if you are going for a Ruksha Agnikarma, you have to start from the medial side. That is the area which is to be poked first of all. So I'm just showing the picture only. So the basic area which is being usually seen in plantar fasciitis is the medial, that is the area. That is the area where the plantar fascia is being attached. There you will get the maximum point of terminal nerves. So you have to give when you do the Agnikarma with the Shalaga, you have to focus on that area, and the rest of the thing, it is depends on the condition of the patient. Avastha Nisrudam, Kana Nisrudam. Next one. So Jalugavajarana and Sringavajaranam followed by Agnikarma for Pitta predominant conditions. So for some conditions are there where Snigdha Agnikarma or Ruksha Agnikarma does not work initially after doing Amabhajana. So such conditions may be Pitta predominant condition. In such conditions, we may be selecting a internal medicines like Pajanamrudam Kashaya, which is mentioned in the Jora Chikitsa. And after Amabhajana, we will be proceeding with the Sringavajaranam or Jalugavajaranam. That will give you a very good symptomatic result, followed by, to prevent further recurrences, after Sringavajaranam or Jalugavajaranam, I used to give Agni also to prevent Abuna Bhautam, to get an Abuna Bhautam. it is better to do an Agni Karma also. So in Pitta predominant condition, the situation, the selection of the Anusastra is different. In Kapha predominant condition, the selection of the Anusastra is something very different. So, as just like selecting the medicines for internal use for a Vata predominant condition and a Kapha predominant condition, a Pitta predominant condition, you have to select the Anusastra also likewise according to the condition of the patient and the constitution of the patient. Okay. So summary, Anusastra is a very good unique tool for Ayurveda for management of selected diseases like plantar fasciitis. Indications, contraindications are to be followed as per textual descriptions. When you go for Anusastra, you have to keep in mind that selection of the patient and preoperative procedures are very important. Anusastra should be done in a very sterile area. Good postoperative care prevents complications. And Anusastra is a simple, safe, and sure therapeutic procedure which aids the clinical efficacy of an Ayurvedic practitioner apart from the internal medicines and external applications of Leba, Unaha, such conditions. So Anusastra is a very powerful tool which gives you very good clinical, pathological, and even etiological change of etiological level of improvement in the management of heel pain and especially the plantar fasciitis. So hypothesis regarding the clinical efficacy of Anusastra is it can be effect on pain pathways, it can be effect on heat pathways, Agni Karma, affecting neural pathways, eliciting neuromuscular reflexes and releasing pain and spasm, protein coagulation theory in Agni Karma. These are some postulations. There's some hypothesis only. It has to be rolled out with the proper clinical research. So rehabilitation is a very major important thing, which is even though the symptomatic result is being given to the plantar fasciitis, so you have to go for a rehabilitation as the foot is being overused always. So it should be the muscles should be properly balanced. It should be properly trained. For that, rehabilitation is a must. So after the inflammatory stage, you should not go for the rehabilitation. After Amavajana, you have to give proper rehabilitation. That is very important. So rehabilitation of ankle joint, generally a cylindrical ball or glass is placed beneath the plantar aspect of the foot and rolling should be done to give a foot arch exercise. Ankle clutches, single heel raise of both legs, toe raise, calf stretch, gastrocnemius soleus muscles must be strengthened. So here lies the importance of Indravasti Marma. Indravasti Marma is a Mamsa Marma. So with the calf stretch and gastrocnemius soleus muscles must be is getting stretched. So even after the clinical improvement is given to the patient, so you have to think about the rehabilitation phase also. Otherwise, a patient will be getting recurrence again. To prevent recurrence, you have to go through the rehabilitation phase properly. So you have to keep in mind all these points when you are rehabilitating an ankle and foot. So the pathya of ankle joint, as far as pathya is considered generally in the level of diet only. Here, as far as musculoskeletal condition is considered, you have to think about the activities also. Wear walking or jogging shoes that provides good support while going for exercise or sporting activity. High top shoes provide support for the people with the ankle problems. Wear comfortable shoes that fit properly. Exercise on level surfaces. These are very relevant nowadays. Nowadays, everybody is going for exercises to the gym, going for Zumba dance, going for yoga practices. So keep in mind all these things that when you are going for exercising, you have to wear proper footwear. That is very important. That is pathya of ankle. So footwear correction and optimum use of orthotics. That is also a part of treatment. Correction of footwear plays a significant role in managing these conditions. Properly designed footwear can contribute to improved foot mechanics and reduce the stress on affected tendons. Here, Consider the diabetic charcot foot when advising a footwear correction to a diabetic patient. Mild heel raise footwear should be completely avoided, even if a retrocalcal patient is a culprit for the pain. So that is to be kept in mind. So proper footwear correction is a basic thing in managing the foot and heel pain conditions properly. Physical therapies, including exercise to strengthen the stretch affected area, are valuable components of the management plan. To avoid recurrence in plantar fascia, there is definitely a role in pathyacharana, lifestyle modification, not only the dietary condition, dietary regulations, to avoid accumulation of hama, as well as application of head oil before bath. It is a custom, especially in South India and especially in Kerala. Everybody is going for every day to twice head bath like that. So when they are going for head bath, they used to take head oil, talakkanna, which we used to follow. So when you are selecting that oil, if a person is using a oil which is a Siddhavirya predominant, it can stimulate, it can go for recurrence of plantar fasciitis. It can be a stimulating cause for plantar fasciitis. Hyperuricemia should be considered. So the pathya ahara should be followed. High protein diet should be avoided, especially the non-vegetarian should be reduced if a patient is a non-vegetarian habit of diet. So they have to properly hydrate, proper amount of liquid fluid should be administered every day. So proper such dietary modifications as well as lifestyle modifications also is a need to prevent further recurrences. So a cylindrical ball is very good in giving a plantar stretch for rolling should be done. A cylindrical ball or a glass is placed beneath the plantar aspect of the foot and rolling should be done. That is very good as a rehabilitation, as a good tool for giving exercise to the plantar fascia and foot muscles. And orthotics, when you are considering the orthotics, you can select selectively heel soles, insoles with the various components. This is a very soft silicon-based heel cushion, which is very giving you a very good support to the heel area, which is very good, very well tolerated and very efficient in the management of plantar fasciitis. Those who are having acute phase of the plantar fasciitis, they can use this silicone-based gel cushion. Next one. So the concluding, I am focusing on the importance of integrative management. So diagnosis, first of all, diagnose the condition with the proper differential diagnostic prevalent conditions and summarize 5 Ayurvedic principles right from the Mahapachana, internal medicines, Therandadaila Prayoga, and also Anushastra Karma, Marma considerations and Marma points should be considered. So these are the Ayurvedic concepts regarding the management of plantar fasciitis, especially that is plantar and medial heel pain. Plantar fasciitis 1, heel pad atrophy 2, Baxter nerve entrapment 3, and calcaneus stress fracture 4, and tarsal tunnel syndrome. These are the major differential points which is being seen in the clinics. So you have to differentiate all these things and treat accordingly with the proper Ayurvedic principles, with internal medicines, as well as using suitable Anushastras for prevention of recurrences. So that is my perception. Thank you once again to RIV and all the officials of RIV who are providing me a facility to present a small subject, but it is very relevant nowadays. So I hope it is over. And once again, thank you RIV for providing us right from Webley Ayurveda Hospital all the wishes. Thank you. Happy New Year to one and all.
Thank you so much, sir. We will begin now the query session.
Okay.
If anybody has query, you can unmute yourself and raise your hand. There is some queries in chat box that I read out. For mum therapy, are there any rules like empty stomach, etc.? How frequently it should be done, sir?
Excuse me. It's not clear.
Sir, one question is there for therapy. Are there any rules like doing empty stomach, or how frequently it should be done? What will be the frequency of practicing it on the patient?
Madam, sorry, I'm sorry. Your voice is breaking.
Okay. Sir, is there any rule like the patient should be empty stomach before practicing this marma therapy? That is the question of a participant.
It's not a must. It's not a must. It's not a must.
Okay. Okay, sir. The second is how often we do this marma therapy in a patient, like in a week, how much sitting we are going to put to the patient, and it's like that.
It depends on the pathology. If a pathology is an acute phase, single therapy will be sufficient. And if it is a chronic situation, you may have to go for a repeated 2-3 episodes, two, 3 sessions of pharma application.
Okay, okay, sir. Sir, another question is with the karma having any role in management of plantar fasciitis?
Yeah, it's of course. Viddha karma is being very good role in the management of acute painful situations. I don't mean that it is a complete cure therapy, but it offers a very good pain relief. Just like modern NSAIDs, it is working. For the time being, to manage the pain, it is very, very clever.
Okay, sir. Thank you. Sir, another question is in what stage of plantar fasciitis immobilization is required?
Plantar fasciitis usually in the very acute inflamed condition. If it is a result of as a result of generalized systemic arthritis condition, for the time being, initially the Amapachana stage, you have to go for some immobilization. Only when the Amapachana is Ama is being digested, so you have to reduce the level of immobilization.
Okay.
More than immobilization, some soft silicone jelly, soft healing supports will be fine.
Okay, sir. Do we have any other queries? I request the participants kindly participate and ask your queries if you have any.
Good afternoon, Matthew. I am Dr. Ramanathan. Matthew, are you hearing?
Yes, sir, you are audible.
Matthew, are you audible?
Sir, somebody is calling for you, sir. Dr. Matthews.
Yeah. Nothing. It's
Hello?
not audible, madam.
Hello? Hello?
Yes, sir, you are audible, sir.
Matthew, you had a wonderful presentation. You are covered A to Z regarding the Gyan Ganga. We are also educated more.
The plantar fasciitis and Achilles tendinitis, the line of management is entirely different. So in Achilles tendinitis, in the acute phase, you have to go for some level of immobilization, the acute phase. And you have to go for leva unaha like that one initially. In the plantar fasciitis, that much of immobilization may not be necessary. And you have to go for avagaha, like that one in the
More external treatment. Yes. Sir, I think Dr. D. Ramanathan, sir, was asking for you.
Yeah.
Lately, yeah.
Yeah.
Matthew,
Sir,
are you audible now? Are you audible?
Taping, right. Taping is useful as a tool which provides instant temporary relief. In which
Ishtika Sweda.
Ishtika Sweda is actually an equivalent to Rucha Agnikarma itself.
Okay.
Right. It's an equivalent to when when I focus view that Utshagni Karma is relevant. In such condition, Ishtika Swedam is also can be done. Utshagni Karma.
In
So
the
Kapha
stiffness
Varana
and the Kapha state, I think.
Kapha Varana. Yeah.
Okay, sir, we will be concluding the session then.
Yeah. Thank you, ma'am. Thank you.
Thank you so much, sir. On behalf of organizing committee, I would like to thank you, Dr. Matthews Joseph, sir, for delivering such insightful lecture. I would like to
Yeah.
extend my sincere gratitude to our mentor, Padma Bhushan Vaidya Devendra Trigunaji, President Governing Body RAV, for his continuous support, guidance, and blessings. I thank our director, Dr. Vandana Siroha, ma'am, who is the guiding force for all the events at RAV. I would also like to thank Vaidya Rajesh Kotecha, sir, Secretary, Ministry of Ayush, for his participation and encouragement in all our endeavors. Most importantly, I would like to express heartfelt thanks to all the gurus, shishyas, and other scholars who, with their presence and active contribution participation, make this webinar a successful one. So the next webinar session in the Gyan Ganga series will be delivered by Dr. Pankaj Kumar Mishra, sir, on if and buts of Ayurvedic physician and how to cope up with the dilemmas. Thank you so much. Happy New Year to all. Thank you.